Hello, my name is Ryan Griffo. I'm here with Jeannine Norris and Dave Sassa. Jeannine is the director of At Least Kids Foundation, and Dave is a committee member for the Cupid's Cranium Run. Jeannine, I would like to ask you first, can you tell us about your experience as a child parent?
Our daughter Quinn was diagnosed with a brain tumor when she was 4 years old, and it was something that really no parent ever expects. She was on the balance beam of gymnastics the day before, was healthy, bubbly, energetic child, and then she had what appeared to be a seizure. And I took her to the local hospital. They did a CAT scan there, and they told us that she had a brain tumor. So we were immediately airlifted to CHOP, and she had surgery 2 days later. And we kind of just found ourselves thrust into this world of that we really never expected. So we were so thankful to have CHOP as an institution of expertise and knowledge right here in our own backyard that could take care of Quinn.
Absolutely. And Dave, could you tell us about your experience as well?
Yes, my daughter Madison, she was actually diagnosed when she was 2.5 years old with a brain tumor. She has a disease called neurofibromatosis, which causes tumors to grow on your brain and spine. And so that was diagnosed when she was 2.5, and we were referred here to CHOP. And she went through some chemotherapy, and she was fine for 10 years. And then several years ago on a normal MRI follow-up scan, they discovered a large tumor. So she had surgery here, and then things were fine for a while, and then she was on chemotherapy, and then another tumor appeared, and she had a second surgery, and then actually she had a third one recently this past August. And because 3 months ago we've had a follow-up MRI, now there's been more tumor growth, so now she's starting chemotherapy. But my experience here at CHOP is it really, as Jeannine said, it's amazing here because when you come to an institution like CHOP, you're not just dealing with one doctor. It's like when you go to your family doctor, you have one doctor is dealing with 400 patients. When you come here to CHOP, you're one patient and you have 100 doctors, and you have a group of doctors that are collaborating all the time. And when they come and see you in the hospital, she's been in numerous times for surgery. There's a group of doctors, and it's amazing how well they work together. Neurology, oncology, surgery, and everybody here, the nurses, the staff, everything is just a positive, experience for the child because you're always trying to keep your child's spirit up the whole time.
Oh, absolutely, definitely. That's something that CHOP really does well. Jeannine, if you could tell us about your foundation, At Least Kids Foundation?
At Least Kids, the mission of the foundation specifically is to provide and assist the Pediatric Brain Tumor Research Program funding. We were surprised when we learned a little bit more about pediatric brain tumors. We were surprised at how little money is directed towards something that can be so debilitating and is such a leading cause of death for children. As Dr. Storm and Dr. Resnick said, it's not just the brain tumor itself, but it's the treatment of the brain tumors that really have cognitive effects on the children and developmental effects on them as well. So we thought the most important thing we could do is get the money directly to them. So that is specifically our mission, is to provide the funding and assist in funding.
Yeah, that's brilliant. And now, can you tell us about Cupid's Cranium Run that's coming up very soon, actually,
Yes.
Very soon.
Yes.
So if you could tell us about that.
The Cupid's Cranium 5K and 1 mile walk is our major fundraiser. This year, this February 20th, will be our 4th year. We've had great success with it. As a committee, we put together a committee of people who are parents of kids who have dealt with brain tumors, folks in the community who are just great volunteers and willing to put their work behind our cause. And we kind of brainstormed about what could we do as far as a major fundraiser. We've had different things in the past. We've had people name their racehorses after At Least Kids and donate part of their winnings towards us. We've had companies do golf outings and donate their proceeds to At Least Kids, but we wanted something to specifically call our own. A number of us are runners on the Cupid's Cranium Committee, and we thought it'd be fun to do a 5K. And one of the reasons for this was to pull together the community of folks who wanted to support all of us who have gone through this with our children. But we also wanted to pull in a new group of people that might be elite runners or weekend warriors that knew nothing about pediatric brain tumors, but once they were introduced to the cause, just because they came to the race, they would be happy to continue to support that. So our first year we had over 500 people, which is really unusual for most 5Ks of 100 people, and we had over 500. This year we had close to 750 people. It takes place in February, which is a challenge, but it's one of the reasons why we did it in February is because we don't need to compete then with many other 5Ks that are out there, and it draws a lot of attention at the time. We've been very fortunate. Our sponsors have been very, very generous, and we've raised almost $100,000 for the pediatric brain tumor research at CHOP. And it's a lot of fun. People come out in costumes. We have goofy prizes. We have people competing the first time in a 5K. We have elite runners coming because they want to race in February. So it's just a great time.
That sounds absolutely fantastic. It really does. Dave, if you could speak to us about what made you become involved with this committee as well?
Well, actually, when we first saw the race, the first one, we went as a fundraiser because it's in our community, and we thought it was such a great event, and we brought a lot of people, our family and friends, and my daughter, and we think we're going to keep going to this because we knew the money supported. And after the second year, this lady next to me, we got in contact with each other, and actually I never told her this, but I was actually going to call her to ask to be on the committee when she called me through another person and asked if my wife and I would be willing. And it was inspiring for me. As far as the race, it's a great event. Everybody loves it. It's a powerful thing for the community. The committee members are just a group of caring, unselfish people that donate their time for this cause, and it's amazing to me. It inspires me. And one thing you learn as a parent, as Jeannine said, it's not just the doctors are treating the tumor. You realize that you have to treat the cause and find a cure. And I quickly learned by being a patient, or my daughter being a patient here for so long, it costs money. Everything costs money, but the research costs money. And what a better idea to have this fundraiser go directly to the Brain Tumor Research Foundation. So I think it gives you, some control in it. My daughter, she enjoys it. I think it empowers her a little bit that she's, taking, a stand and seeing if she can help herself, for this course. So it's rewarding for our family.
Oh, absolutely. And Dave, can you talk to us about Team Maddie and how important it is to you?
It is. Team Maddie is obviously my daughter. We were able to get a lot of people to support, family, friends, work colleagues, and I think we had close to 80 people come out. So it really is important. It's important to me to get as many people there to that race, not only that fun, but to support the brain tumor research. But it's special, it's a special place in my heart, and my daughter really likes it. It's an emotional day for her because all these people are there, to support the cause, but they're there for her. We have sweatshirts with her name on it, and she enjoys it, but it's a difficult time for her because it's kind of like surreal when she realizes hey, everybody's here for me and other people.
Yeah, absolutely.
Yeah.
And going back to Jeannine, can you talk to us about, once again, what are the challenges faced as a parent who has a child with a brain tumor?
Well, we were fortunate in the fact that Quinn, when her brain tumor was diagnosed, it was a benign brain tumor. It's called a meningioma with meningoangiomatosis, which is something that usually occurs in older people. So her surgery did take care of the brain tumor, and we were very blessed in the fact that she didn't need to go through treatment after that. She ended up having surgery again when she was in 4th grade for something that was related to the tumor, but she's been very healthy, and we're very fortunate for that. That was one of the reasons why we started At Least Kids, because we have CHOP to thank for the quick action and taking care of her like they did. We want to kind of give back and give the same help with the same prognosis to other kids who are not as fortunate to be in the same position she was in. So we have seen a lot of, through our dealings with CHOP and serving on the board of the Brain Tumor Research Program, we've learned that it can just be a debilitating, scary prognosis, and no parent, like I said, is ever really ready to hear that your child has a brain tumor. And it's a whole family experience. So that's one of the reasons why, that is the reason why we started At Least Kids, is to give back and hope that every kid has the prognosis that Quinn has. She was 4 when she was diagnosed, and she's a sophomore in high school now. And so, like Dave said with Maddie, it's a sort of an overwhelming experience for her when she's there at the event, because it's so much support for something that went on in our family. So I would encourage others, if they're looking to do their own event or to help contribute to At Least Kids. Certainly we always need more people at our event. Other companies can have golf outings, or we're looking for high schools and colleges to have different type of events and contribute to At Least Kids, or maybe even play off of the Cupid's Cranium. They can have their own events there. We can help out with that. So there are a lot of different ways that it can be taken in the community. It doesn't really have to be about brain tumor research. It can just be a really fun event and just bring awareness to the cause.
Absolutely. And Dave, if you could speak about your challenges as well.
Yeah, as Jeannine said, it's, for me and our family, it's been like a roller coaster for up and down. It's hard because you don't have any control over it. You know, you can't control what her medical diagnosis is. You can't control, anything that happens to her medically. There are developmental things because there's a brain tumor, the part of her right frontal lobe. So it's harder for her to do certain things. And that's challenging for her at school and socially and other things. But she gets by, and really the main thing for me is to always have a positive outlook on things. To be, things always could be worse. Always be positive. Try to keep her spirits up. But, the biggest thing for me is I'm just a layperson. The doctors you talked to earlier, we're putting my daughter's life in their hands, literally, when they're doing surgery. So I have the utmost respect for these men and women that do this every day. And there's really, I pray and I hope, that they do the best job that they can. And that's really all you can do. And as far as the cause, the second part of it is the raising money to find a cure, to help these guys and ladies, in their labs. And that's what it takes, and that's what inspires me to continue to do this. And I would encourage anybody that wants to contribute in any way to be part of Cupid's Cream, or start your own, or even donate money or volunteer. Anything you can do to help children is the most rewarding thing that you could do in this particular field. It really is.
Even though by comparison, pediatric cancer is rare, brain tumors are the leading cancer in children, and it's actually the leading cause of disease-related death in children. And that means actually a lot. And there are a variety of types of calculations you can actually do about how impactful a cancer is. And it's not just about the number of cases you have, it's also the lifelong effect, right? The number of years that are affected, the interconnectedness of the family and the whole structure that's affected. And so it's actually a very relevant and important disease to address. And sometimes people miss that because it's rarer. Kids don't get cancer because they smoke or they sit out in the sun. And so the causes of cancer in these children is actually not preventable, as far as we can tell. And so the mandate is ever so much higher for us to figure it out. And the truth is, in studying the pediatric cancer space, you'll actually learn not just about pediatric cancer, but also about adult cancer. In fact, some of the first efforts that we engaged in low-grade gliomas, the things we learned about that cancer are now being applied in skin cancer. And so the knowledge space just hasn't been attacked in the way that it should, just because there hasn't been an infrastructure. So for us, it's been a combination of building a scientific enterprise and infrastructure that is collaborative and really based on an open access model, but at the same time driving clinical trials and the discovery space within certain diseases.
Absolutely. And speaking about children as well, what specific challenges do children face that do have brain tumors?
So one of the big things that they have is the therapy. So when you have this young developing brain, the therapies that they will get after it's been resected are going to have different effects compared to an adult brain. So some of the treatments that they get have serious side effects as they grow older. So even if you can, cure the tumor or at least hold it at bay for decades, when you're seeing this rapidly growing brain that's been affected by the radiation especially, and so it's not just the treatments. We need to get better treatments that are going to have a lot less side effects, and that's been, I think, the real problem. And like Adam was saying, with the different causes, they're just true. They're true. Truly innocent, and they've done nothing, and it's probably a developmental problem. The good news is, though, with that comes probably smaller areas that are abnormal, which might give us even a better opportunity to have a larger impact, that there's probably orders of magnitude fewer alterations in the children, so that if you can find what those are, either turning things on or off, it could have a much bigger impact, I think, than what we see, and why it's been so much harder in adults to cure. I think it gives us a bit of an advantage in the children.
Yeah, I think it comes back to what we were saying earlier, which is that most of the therapies that are currently in practice are really just targeting any rapidly dividing cell. That's why you lose your hair or you have GI tract issues when you're receiving treatment. But as Jay mentioned, these kids are rapidly dividing beings, right? Mm-hmm. And so the challenge is, how do you achieve specificity? And the only way we know how to do that is to understand what's different about the tumor so we can target it specifically.
Oh, very nice. And now, follow-up question is, what funding resources has been developed through CHOP for the pediatric brain tumors?
Yeah, CHOPS, well, as an institution, they've invested in the infrastructure, which has been wonderful for us and has allowed, really, I think, our collaboration and for us to make advances. So as an institution, they've gotten behind us. There's federal funding, which is pretty underserved in pediatrics for a host of reasons. The other approach we go to are foundations, which are a huge supporter, and then just as part of that, just individual philanthropy, which has been, for us, the foundation support and the philanthropy is what has totally driven what we're doing.
Yeah, in fact, it's been transformative for us. Most scientists like myself are largely dependent on NIH or government funding. But the minute you look at the portfolio of the National Cancer Institute, you recognize that that becomes almost impossible to drive the kind of efforts that are necessary. Only 4% of the National Cancer Institute's budget is relegated to pediatric cancer research. And even if you're not doing pediatric cancer, your chances of getting a grant from the NIH is only 10 out of 100. And so once you start sort of multiplying the statistical probability of what are your chances as a pediatric researcher to actually achieve a grant, and even though we've been successful at that, achieving multiple grants across a large number of disease areas becomes more and more difficult because of that limited space. And so the partnership with foundations and families themselves, and that's the way we actually think about it, is direct partnership with them towards a common cause. That has been transformational. It almost supports all of the research that we've done to date has been supported by that. In fact, traditionally what we've seen is that it's not until we've built a large infrastructure underpinned by the partnership with foundations and parents and families that then the NIH or government support will come around to sort of leverage that. But almost all the primary effort is supported by foundations and their partners.
Absolutely. And can you guys also discuss how important philanthropy is for the program here at CHOP for us?
I can't survive without it.
Yeah.
That's the bottom line. Without the philanthropic support, none of what we've built would have happened, and it just doesn't continue.
Yeah,
absolutely.
As an example, some of the first tumors we decided to study in the laboratory here as we were building the infrastructure, we identified a set of mutations that we thought could be targeted. And now these mutations and how they were targeting them are now being implemented in the clinical trial space. And this has only occurred in the last probably 5 years or so. none of that would have actually happened in the absence of philanthropy and foundation support. And it's not until the clinical trials actually began that we finally were able to even get funding from the NIH or other government support. And again, it's not because there's inherent resistance in supporting pediatric research. There's just a recognition that it's so much harder to do. And so the probability of success is lower, and that's why there's lack of investment in it. But we actually think we should bet on the probability of success in kids. And that's what the parents think and most foundations.
Definitely. Well, Dr. Storm, Dr. Resnick, thank you guys so much for your knowledge and for being here today. Jeannine, as a director, may you tell our viewers how could they become involved and be a fundraiser or anything like that to help out this great cause?
Yeah, I think getting back to the fact that you can do any sort of event, you can get, people can get teams together to come out to Cupid's Cranium. We have a lot of fun teams and a lot of fun different names and kind of crazy names that people come up with. But particularly this year, we saw people rallying behind even people who weren't kids that had been affected with brain tumors. Because as Adam Resnick and Jay Storm said, you know, the treatment of brain tumors, and sometimes in finding a cure for one disease, you help find a cure for another. And so we just have had a lot of great success with that. But again, colleges, high schools, any kind of student groups, golf outings, dress down days at schools. There are all kinds of ways to support Cupid's Cranium. And if somebody wanted to start their own 5K or 1 mile, you know, committee members, we'd be happy to talk to the committees of the folks that want to start, which we've done. And we've been through the trenches, so we kind of know it's, you know, what it's like in the very beginning. So we're always helpful, you know, and willing to offer advice too.
Yeah, that's brilliant. Jeannine, Dave, thank you so much for being here today. I really appreciate it. And At Least Kids Foundation, as well as the Cupid Cranium Run, which is on February 20th.
Yes, sir.
February 20th. So for Health and Wellness, my name is Ryan Griffo. Thank you so much for tuning in.